So if you're watching this video, it's because we've talked about the fact that you tore your ACL and need an ACL reconstruction. We've talked about different types of graft options that I will use to reconstruct your ACL, but essentially what we're doing is we're trying to recreate the ligament that lives between the femur and the tibia, which is this ligament right in the center, and it controls the motion of the shin bone on the thigh bone or the tibia on the femur so that it can't go too far forward. The surgery will be done as an outpatient, which means you'll come into the hospital and leave and go home on the same day. It's done under regional anesthesia, so you'll get some sedation along with a spinal anesthetic in your back, which will numb you up from the waist down. You'll wake up in the recovery room, the feeling will come back in your legs, and you'll be taught how to walk with crutches with one of our physical therapists. You'll have a long brace on your leg from your hip to your ankle. You'll see me back in the office sometime between 10 and 14 days so I can remove your sutures and check your range of motion and see how the progress is going with physical therapy. You'll also see me again at 6 weeks. We'll take you out of the brace, which is important that you wear for that first 6 weeks to protect your ligament. And as your strength comes back, we'll wean you out of that brace slowly over the course of about a week or two, sometimes into a smaller brace if your quad is not quite ready for you to be out of a brace altogether. You'll then see me back around 3 months. We'll again check your function and see how your strength is coming back, and you'll continue to work with a physical therapy most of the time for about 4 to 6 months with physical therapy, and then after that on your own. At the 6-month check, I will ask that you do a strength check with our physical therapist to make sure that you're ready to progress to return to sport and make sure that you have enough strength in your knee to protect your brand new ligament. And most patients are back to full recovery and they're cutting or pivoting sports someplace between 6 and 9 months depending on that strength recovery.